Hi guys, welcome back to my channel. In this video, I'm gonna talk about ATI exam. So in nursing school, uh, we have to take ATI exams aside from taking our regular exam. So ATI exam is very, I think, built in the program because, it's like a proven tool for nursing to actually train the students to be well prepared for the NCLEX exam. So example of the ATI book is this one. So I have this one, the ATI Pediatrics. Our exam for ATI is not this week, but it's gonna be next week. So I'm trying to like study a bit on the exam because sometimes like in the regular exam might not be like totally the same as ATI style of questioning. So I have to like get used to also for ATI. But again, like some of our questions that we have in our regular exam would be tailored towards ATI or NCLEX because at the end of our program, we'll have to take the NCLEX exam as well. And before we even graduate, like we have to take like an exit exam for nursing, and once we pass that with the minimum required score, then that's the time we can actually um, be able to apply to take the NCLEX exam. So the things I read on the ATI, whenever you're reviewing um, some questions, like example dynamic quizzing, that usually for me, like it's my like one of my fault is like whenever I do actually like answer questions in ATI, that once I saw the rationale of the correct answer, I skip. Because again, I'm kind of rushing a bit. So the recommended style for ATI is like whenever you see the rationale for the correct answer, you should also read the rationale of the incorrect answers. The reason for that is that it would give you also an idea of why they put the other ones as a distractor or a choice also to like make you mislead you to whatever it is the correct answer. And also like some of the incorrect answers I feel like can be made into a different question. So if you get the concept behind that, then who knows, like some questions might be like related to it, so it's easier for you to actually answer it correctly. um so whenever we do ATI exam, there's different uh, levels of proficiency in ATI. So the highest you can get is a level 3. Then level 2 would be the above average score that you would get in ATI. And then level 1 proficiency, it needs really a lot of review because you hit the basic ones, but you actually have to do more studying to be able to prepare for NCLEX. And then if you scored below a level 1, then you have to remediate because basically you didn't know anything about the topic enough, even like the basic one. So most of the school and in my program, or in my in yeah. So we have to the recommended is like we have to get level 2 or higher whenever we're taking the ATA exam because and we have 2 tries to actually get a level 2. Level 1, if you do get a level 1, you have to do an ATI focus review. So focus review is like whenever because the ATI would tell you like what areas your weak areas, so that you can actually study on those, read about it, and then once you retake the ATI, you would have more chances of making the correct answer or getting a higher score than the previous one. So that's the thing. And the the levels also of proficiency, again, like give in my program they give you points for the levels that you get. It's just a bonus points like on top of like whatever how much points you already have in your course. So for level 3, again, it's higher points because it depends on the class. So and then level 2 be that's the aim or the targeted like level of proficiency. You would get the full points aside from doing the extra work that you have to do for the prep for the ATI. And then level 1, then doesn't get any points, and then if you're below level 1, it's just gonna drag you even further. Yeah, so those are the levels of proficiency, and based on the feedback from other people who took the NCLEX exam and ATI, and also based on the ATI also, when I read something about it, that the NCLEX is way easier than ATI, because ATI is basically um, becoming more difficult just to be able to give you more chances of passing the NCLEX, like first time, or because again, like if you take the NCLEX a couple of times, it's just like starting to demoralize you, like if you don't pass it the first time. But again, you can still retake it with whenever you fail it. But again, the goal is just to pass it one time. Yeah, I just want to share that this video about ATI to some people who are not aware. 'Cause some people who were in nursing, of course, they already know what ATI is and what's the purpose of ATI. Alright, guys, thank you guys for watching this video.